Hello, hypertension resistors. Dr. Tanya here. When managing your prescriptions, the choice between a 90-day supply and a 30-day supply can significantly impact both your convenience and your wallet. Have you ever stopped to think about whether you're getting the most out of your refills? We're not just talking about the medicine itself, but also your time and money. Let's be real. Nobody likes spending more money than they have to, especially when it comes to something as important as your health. Opting for a 90-day supply of your medication can often save you money compared to refilling a 30-day supply every month. You're essentially buying in bulk. Many insurance plans recognize the financial benefits of 90-day supplies and offer lower co-payments for them. They understand that encouraging people to get a larger supply at once can actually reduce overall healthcare costs in the long run. But even if you don't have insurance, or if your insurance plan doesn't offer specific discounts for 90-day supplies, don't worry. Many pharmacies have their own discount programs that can make a big difference. These programs often provide lower prices for 90-day supplies, regardless of your insurance status. It's always a good idea to check with your local pharmacy to see what kind of savings programs they offer. Remember, every dollar saved on your prescriptions is a dollar that can be used for other important things in your life. So next time you're picking up a prescription, be sure to ask your doctor or pharmacist about the cost savings of a 90-day supply. It could be a simple change that makes a big difference in your budget. We all lead busy lives, and sometimes it feels like there aren't enough hours in the day to get everything done. Between work, family, errands, and trying to squeeze in some much-needed relaxation, who has time for constant trips to the pharmacy? Well, that's where the convenience of a 90-day supply really shines. Imagine this. You only have to make one trip to the pharmacy every 3 months to pick up your medication. That's 4 times a year instead of 12. Think about all the time you'll save by not having to make those extra trips. You can use that time for things that are more enjoyable and meaningful to you. When you opt for a 90-day supply, you can free up that mental space and reduce the stress associated with medication management. This increased convenience can be especially beneficial for individuals who have mobility issues, located far away from a pharmacy, or have busy schedules that make frequent trips difficult. By simplifying your medication routine, you can make your life a little bit easier and focus on the things that matter most. We all know that taking our medications as prescribed by our doctors is crucial for managing our health conditions effectively. But let's face it, life can get in the way sometimes, and it's easy to forget a dose or two, especially when we're busy or feeling overwhelmed. Unfortunately, missing doses can have a significant impact on our health, making our conditions worse and potentially leading to complications. That's where the improved adherence aspect of 90-day supplies comes into play. When you have a larger supply of medication on hand, you're less likely to run out and miss doses. It's simply a matter of having that safety net there to keep you on track. Think of it like this. If you only have a 30-day supply, you're more likely to cut it close to running out before your next refill. But with a 90-day supply, you have a much larger buffer. Studies have shown that people who get their medications in 90-day supplies tend to have better adherence rates compared to those who get 30-day supplies. In today's digital age, we have more options than ever when it comes to filling our prescriptions. Gone are the days when our only choice was the local brick and mortar pharmacy. Now we have the convenience of mail order services that can deliver our medications right to our doorstep. And here's the best part. These mail order services often offer exclusive discounts for 90-day supplies, making them an even more cost-effective option. Think of it like this. Mail order pharmacies don't have the same overhead costs as traditional pharmacies. This allows them to pass those savings on to you in the form of lower prices. Many mail order services specialize in providing 90-day supplies of maintenance medications, the kind of medications that people take on a long-term basis to manage chronic conditions. Of course, it's important to do your research and compare prices from different mail order services to make sure you're getting the best deal. By exploring the world of mail order pharmacies, you might be surprised at the potential discounts you can unlock for your 90-day supplies. Mark Cuban's Cost Plus Drugs offers medications online at lower prices by cutting out middlemen. You'll pay a 15% markup on manufacturing costs plus a small pharmacy fee. Check the link in the show notes to see if your prescription is available and start saving. We all know that brand name medications can be expensive, sometimes prohibitively so. But what many people don't realize is that there are often equally effective generic alternatives available at a fraction of the cost. Generic medications contain the same active ingredients as their brand name counterparts, but they're sold under a different name and often come in different packaging. The great news is that several large pharmacy chains have recognized the need to make generic medications even more accessible and affordable for everyone. They've introduced what's known as the $4 generic medication list, which features a wide variety of commonly prescribed medications available for just $4 for a 30-day supply or $10 for a 90-day supply. These lists include medications for a wide range of conditions such as high blood pressure, diabetes, mental health, and more. To take advantage of these $4 lists, simply ask your doctor if your prescription can be switched to a generic version that's included. And even if your medication isn't on the $4 list, don't despair. There's another powerful tool at your disposal, GoodRx. GoodRx is a free app and website that provides coupons that you can use at pharmacies to reduce the cost of your prescriptions, both brand name and generic. Simply search for your medication on GoodRx, compare prices at nearby pharmacies, and present the coupon at checkout. GoodRx can often find you significant discounts, sometimes even beating your insurance copay. By taking advantage of these resources, the $4 generic medication list, GoodRx, or Cost Plus, you can significantly reduce your out-of-pocket costs for prescription medications. When managing your prescriptions, being informed can save you time and money. Discuss options like 90-day supplies, generic medications, and discount programs with your healthcare provider or pharmacist. Whether you choose a large chain or a mom and pop pharmacy, the key is finding the balance of cost, convenience, and service that works best for you. By taking these steps, you can make smarter choices and keep your healthcare costs under control. Remember, your health is your most valuable asset, and taking an active role in managing your prescriptions is a crucial part of protecting that asset.